Can I just bring in Hekia Parata, because there was a lot of criticism there of the current government, and your response?
Oh, look, my response is firstly this. The comparisons that Shane Jones is making in terms of what's being funded now and what was promised but not budgeted for under Labor is just absolute rubbish. We have put $1.4 billion into early childhood education. That is the highest ever. Moreover, we have extended the 20 hours early childhood opportunity to kohanga reo, to play centre and to 5-year-olds, which was not provided for under Labor. We have increased the number of places by 3,500 for early childhood. At primary school, which is the core years that children, our tamariki, get to learn to read and write and do maths, we have introduced national standards, and I don't resolve from that one bit, because here's the fact of the matter. The assessment technologies remain the ones that were already in.
Please.
And what we need to know is whether our kids are learning at an earlier stage before discovering at year 9 that they can't read or write, and then expecting the secondary school system to catch them up in 3 to 4 years. And again, in fact, the NCEA 2 qualification rate of girls, Maori girls and Maori boys has both increased in the last 3 years.
Metiria Turei, national standards.
Not enough.
Let's start with national standards and your position on that.
We will get rid of national standards. They are absolutely
because they're committed to failure.
Because they have been used in the US, and the Minister of Education went to the US and knew this. They have been used in the US to disenfranchise Hispanic, Black, disabled children over the year from the education system. That they are the beginning of the process to privatise our education system, which is what this national government plans for our public education system. Now, we will fight that at every step.
We plan for achievement.
We will make sure that kohanga reo,
one at a time, please. One at a time.
Hekia, kohanga reo and kura kaupapa are properly resourced, and that Māori are involved in the standards for that, because I know that there are real issues around the standards of the materials, and for example, that are provided, and it makes it very difficult to offer that quality education. Kohanga reo, you know, they've got a treaty claim against this, Waitangi Tribunal claim against this government because of the funding issues and the lack of respect for that process. So what we know is that we have to make sure that our state schooling system is a high quality public education system for our kids, because most of our Māori kids are in that system. Okay. So that's the one that we need to make sure we invest in that as well.
A comment from you, Hone Harawira?
Just a comment. Just very quickly, national standards don't work, and I'll tell you why from the ground level. One, because I asked a principal of a kura kaupapa, and she said they don't like it because national standards actually dumbs down what it is that they're trying to achieve.
Well, that's a teacher response, not a student response.
And so I went to talk to one of the...
One at a time, please.
I went to talk to a principal in a mainstream school, and she said she doesn't like it for what the reason Metiria said, which is it simply doesn't work, not just for Māori children, but for Pākehā children right around the country, because it doesn't work overseas. So given that those things don't work, we need to relook at what it is we're trying to do. The problem with education right now is we're getting more and more kids, 200,000 before these guys got in, 270,000 who are actually going to school now without a decent kai. So kids who aren't being fed well don't learn well. So hence our program about feeding the kids, giving them the opportunity to want to learn, to participate in the system. If they're not learning because they're not eating well, education becomes a complete waste of time.
Shane,
feed the kids and give them a good start.
Okay, and finally, before we move on...
is not the issue. It's the way our people are taught and what they're taught. And we've introduced tātai ako, which tells the teachers how to teach our people to understand Māoridom and teach them properly.
How do you think that that's going to work, though? How do you think that's going to change the stats? How's that going to actually enable Māori to better achieve?
The same way it has with kotahitanga, except this is full on with everybody. Principals, schools, the teachers themselves, the training teacher colleges, all of them have accepted this. Teachers' Council have accepted it. It's going to change the way in which people teach Māori.
But it's not an overnight solution, though, is it?
Oh,
because come 3 years, come the next election, I dare say you're still going to be talking about this program.
Shane, we actually have 2 kura kaupapa principals here, and neither of them actually do it. I mean, nobody does this. Regardless of them talking about it and saying, bling, 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 it doesn't work on the ground. And what we have to focus on are programs that work right now. And the first program has to be to ensure that the kids are in a position where they're comfortable trying to learn.
Good point to leave.
Is based on kaupapa Māori teaching. Totally.
We have to move on because we do have one more issue to deal with. The third most important issue to Māori is health. Well, if you're Māori, you have a higher risk of dying of heart disease and cancer. You're more likely to suffer diabetes and rheumatic fever, to name but a few diseases. So, what are our parties going to do to improve Māori health? Let's begin with you, Metiria Turei.
So we have to address the causes of ill health and well-being, and that is around poverty in our view, that the gap between rich and poor and the increasing poverty of our people is what is causing such harm all the way through our lifetime. Children who get rheumatic fever because they live in cold, damp homes or in crowded houses, they get heart damage as a result, their life expectancy is reduced as a result. You know, this impacts just by having proper housing for our kids, we can help protect them from the health woes well into the future. We need to make sure that our whānau have decent incomes, raise the minimum wage. I mean, it's criminal that people have to work 40 hours a week and still don't make enough money to put food on their table for their kids. And so their kids aren't getting the food that they need, so they're not able to learn, so they again continue to suffer those health consequences. We have to deal with poverty, we have to deal with the gap between rich and poor.
Do you agree with that, Hone Harawira?
I do, absolutely. In fact, she just read it straight off the mana policy list.
You got it off ours.
But still, to add to that, some really simple things that government could do tomorrow. One of them is get rid of pokies, get rid of loan sharks, get rid of liquor outlets, and get rid of fast food outlets in poor communities. That can be done tomorrow. I mean, it is that easy.
Is that what you would do?
No,
or is that what the Mana Party would do?
That is exactly one of the things that we would do, simply because if money's being spent in all of those areas, then you are denying money to the children, you're denying money for health, you're denying money for opportunities for your children and for yourself and for generations to come. So once you start down that track, you then need to make a very clear decision that the family's health is more important than the profits of those private enterprises in your community, putting people before profit.
What about the Labour Party, Shane Jones?
We've got to bear in mind that over 13 billion every year is spent on health. And under this government, we've witnessed a professional capture of more and more of that budget. Our approach always was preventative, outreach into the community, and funding NGOs to actually undertake interventions that made sense to the target groups, whether they were marginalised whānau, women, men with obesity problems or cancer problems, etc. Under the current government, we've seen a drift towards the power of the professionals. The doctors have clubbed together and they now control more of the health budget than they did with a community focus. Obviously, we're going to roll out for kiddies under 6, 24-hour free care, etc. But we must never lose sight of the fact we're already spending an inordinate amount of money, over 13 billion, and every year we've got to spend at least 300 to 500 million more on health just to keep still. And unless we do more in the community, which is essentially what the Labour approach is, you're going to see the National Party and potentially the Maori Party surrendering control to the psychiatrists, the physicians and the professionals.
Well, let's hear what the Maori Party and National Party have to say. Dr Sharples?
Well, I agree with the other parties that you've got to look at the causes of ill health at the beginning and deal with those. Refurbishing housing and more money into the house and jobs is definitely an important part. But for rheumatic fever, Tariana Turi has already relinquished some money for them, millions of dollars to go into that project. But the reality is, whānau ora is a key direction which involves the families themselves and allows them to actually think about their own situation and, with the support around them, make the decisions themselves instead of a car driving up and telling them what to do all the time. They take control of their destiny. Whānau ora is guaranteed for 4 years at least, so that people who are saying that it's not going to be funded by National, it's here to stay.
Well, that's funding for consultants.
Okay, let's see what National would do.
Well, again, I agree that we have to deal with the causes of these health issues. And the first thing is, of course, that we have to grow the economy so that there are more jobs, so that our people are not dependent on anyone but themselves. We have invested into health, $14 billion. We have seen more under 2 immunised. We have invested, as Dr Sharples has said, supported the Maori Party kaupapa of whānau ora. We have indeed kept community preventative health programs across the country, as well as reducing the waiting time for cancer treatment, increasing the number of elective surgeries, providing for obesity.
And I hope we can achieve this. I do want to go quickly down the line because we've got less than 2 minutes. So can you, in a few seconds, just sum up what why people should vote for your party. We'll start from you, Hekia, make our way down.
I think that voters should vote for the National Party because we believe in the fundamental potential of Maori people to have practical rangatiratanga, to be able to be skilled, to be well, to earn the level of living that they want to have for themselves. We support practical rangatiratanga rather than some kind of pie-in-the-sky idea.
Thank you very much. Pita Sharples, please.
They should vote for the Maori Party for one particular reason, is that we've been so credible this time, even though our philosophical base from National has been quite distant. Even though we're distant, we've managed to make those achievements, not from an agreement, but by sitting at the table and debating and arguing. So all those gains that we've made have been made in discussion. So we're credible, and we can, if we can go with someone so philosophically different as National, then we could also.
Thank you very much. Shane Jones from the Labour Party, please.
Look, make your vote count for people. The essence of the Labour Party is people before profit, which is why we will never, ever acquiesce, never, ever agree with the sale of the assets such as the $100 million that's already been given to the Aussie banks. We're a party that's standing, we're standing very, very candidly on two policies. Keeping our resources to ourselves and secondly, continually investing in people.
Thank you very much. Metiria Turei from the Greens.
I'm asking for two things. One is the party vote for the Green Party at this election and to vote to keep MMP. With a strong Green presence in Parliament, we will be able to bring 100,000 children out of poverty, make our rivers clean enough to swim in again and create 100,000 jobs, green jobs for our people to build a resilient economy that is compassionate and cares for everyone, not just the wealthy few.
Kia ora. Hone Harawira from the Mana Party, please.
E te iwi tēnā tātou katoa. I just would like to leave everyone with a simple message, one that I've given before, some of you will have heard before. Happy are those who dream dreams and are prepared to pay the price to make those dreams come true. Now, when you go into the polling booth, all I can ask is that you set aside your fears, you set aside the lies, you set aside the promises, you set aside the pressures, and you vote with your hopes and your dreams for your whānau and for mine. Tēnā koutou, tēnā koutou.
Tēnā koutou, and we managed to get it through in 2 minutes, Scotty.
Tēnā pai rawa atu. Hoi anora e te iwi korongo ake koutou I ngā whakatau, me ngā whakamahuki a ngā kaitōranga pūnei. Pēhea o koutou whakaaro, tuhia mai he kōrero, he huatau, he harane ki runga I tā mātou a whārangi pukamata.
No te mea hei te rāhoroi, te kōwhiringa pōti o te motu. Ki te pirangi koutou ki te rēhita ki te pōti, kia tere. No te mea hei te pō te paraere, ka katsi te wā kia koutou. Kei te whārangi ipurangi kōwhiringa pōti ngā whakamārama. Ara, elections, irakatsi, org, irakatsi, NZ. Kei konei a haua tērā rātapu mo te kotahi haora me tētahi hōtaka motuhake e pāna ki ngā te tauranga whakamutunga me ngā toa o te kōwhiringa pōti.